I am Celine Cristi Pamolino, your nursing student for today. We are going to do a postmortem care. But before we proceed to our procedure, let us talk what is postmortem care. Postmortem care is for the patient who recently expired. Postmortem care, which can be provided in the home and in healthcare facilities, involves caring for a deceased patient's body. Postmortem care should be provided as soon as possible to prevent tissue damage or disfigurement, with sensitivity and in a manner that is consistent with the patient's religious or cultural beliefs. As society becomes more culturally diverse, healthcare team members should be familiar with the ethics of death and dying, and sensitivity to the patient and family members' culture practices, maintaining the integrity of rituals and mourning. After death, the body undergoes many physical changes, including loss of skin elasticity and change in the body temperature, or what we call algor mortis, purple discoloration of the skin, or livor mortis, and stiffening of the body, rigor mortis. Note, make sure that you're also aware to the cultural, religious, and age-related consideration when delivering this care. Check the patient's chart for the physician's certification of the death of the patient. Note that you should not do a postmortem care. Wait for the physician to declare that the patient is already dead. Verify first before doing the procedure. The physician is the only one who can declare if the patient is already dead. Ask permission and explain to the family that you are going to perform postmortem care, in order for the family to know what are you going to perform. Ask the family if they wish to remain inside the room during the procedure. Provide privacy, not to expose the dramatic events of the patient. Perform hand washing or hand scrub. Prepare the necessary materials such as clean gloves, bath towel, basin, 3 tags and pin, cotton, micropore tape, cravat, shroud, diaper, and clean clothes. Pour lukewarm water into the basin. Wash your hands and put on clean gloves. Close the patient's eyes, then close the patient's mouth to show respect and internal rest. Remove jewelry or any items of the patient and give them to the family for legal purposes, so you will not be charged of theft. Remove all equipment, tubes, supplies, and dirty linens according to the hospital protocol. Remove everything in order to prepare the patient for the funeral. Remove patient's clothes. Make sure that no exposure of any body parts. Perform bed bath on patient. This is done to avoid any discoloration. Start from the least contaminated area to the most contaminated area. Put cotton balls on patient closed eyes, nose, and in the ears, then secures each with a tape lengthwise, so that secretions in the eyes, nose, ears drained in the cotton. Secure the patient's jaw with a cravat. It's because after 15 to 20 minutes, the patient's jaw will open and stiff. Puts on the diaper and new clothes. Give the family option to view or not to view patient. Accompany them as they do. Ask if they would like to be left alone. Applies name tag on the hand and foot. Labeling is the proper identification of the body. Covers and secures the patient with the shroud. Secure the shroud with safety pins. Transport patient to the morgue for embalming or autopsy.